Good morning. Today I will be presenting Huntington disease. Huntington disease affects the nervous system. The nervous system, it's essentially the body's electrical wiring. It takes place in the brain and the spinal cord. It is the control center of the body. It's the one that controls all of our movements, our thoughts, and it consists of neurons that are messengers. The neurons that are in our head the neurons that are in our heads are the ones that send a message to whatever response or whatever other system needs. The nervous system consists of two mechanisms: the central nervous system and the peripheral nervous system. The central nervous system is mainly the brain and the back spinal cord. It, like I said, it controls the movement, sensations, thoughts, speech, memory, everything. And the spinal cord is the messenger through where neurons send the messages to any other muscle or organ. The peripheral nervous system consists of 6 systems. The peripheral nervous system uses cranial and spinal nerves to transmit messages, like the central nervous system uses neurons. The 6 peripheral systems are the sensory, the motor, somatic, automatic, sympathetic, and parasympathetic. The sensory are the ones that sense to internal organs or to external incentives. The motor nervous is the one that sends it to the organs, muscles, and glands. Somatic is the one with the sensory glands. Automatic is the one that controls the heart or any other involuntary muscle. The sympathetic controls the increase of energy spent, and the parasympathetic is the one that controls the less energy spent. Huntington disease. Huntington disease is a disease where it affects the brain. It is a failure of nerve cells throughout the years and mostly affects mental and physical abilities. It is inherited by the parent cells. But it starts to act within 30 years of age. Up until now, they have not found a cure. Some of the symptoms are personality changes, mood swings, and depression, forgetfulness and impaired judgment, unsteady gait and involuntary movements, slurred speech, difficulty swallowing, and significant weight loss. This is a picture of Huntington disease and how it affects the whole brain. Stages of Huntington disease. The early stages: involuntary movements, difficulty with problem solving, depression, and an irritable mood. Developing stage: more involuntary movement problem, weakened speech, and difficulty with swallowing, more difficulty to do ordinary routines. Final stage: full dependency of others, could easily choke and no movement or speaking. However, they can still interpret language in their brain, and they still understand who's family and who's friends, without able to learn anything new. Right now, there is no cure. However, they can treat some of the symptoms for a period of time while the disease advances. Some of the preventions is prenatal testing before, so that in case anybody who's pregnant with a baby that has Huntington disease can know and be prepared for later on advances of the symptoms. HCSA is a center of excellence. It deals with patients with Huntington disease and has many other support groups for them. And that'll be all. Thank you.